Hi, Dr. Cobb here with Alternative Chiro Care. Today I want to talk about muscle response testing, how and why it works. Muscle response testing is the primary technique that I use to evaluate my patients for any condition. So I want to explain today a little bit more about how and why it works to be able to evaluate information from the body. So really, muscle response testing is all based on electricity. Did you know that our bodies are electrical? We actually produce electricity. That's why you could do certain medical tests like an EKG, for example, or checking brain waves by attaching electrodes to the head. You could actually monitor the body's electrical activity. So, when we use this in muscle response testing, what we're really doing is making a circuit with the body. And we're checking that circuit to see if it's either good or bad. And you could check that with a muscle test. So you would start with a muscle that we call an indicator muscle. That is a muscle that's facilitated, it's working, it doesn't have a problem, and we check it to begin with to see that it's strong, because we know we could actually use it as an indicator muscle. If the muscle was weak to begin with, it wouldn't be a reliable indicator muscle. We'd have to find another muscle. But I want to explain this sort of electrical activity about the body a little bit more so it makes sense. If you think of your body kind of like a magnet on one side has positive, the other side's negative. It's electrically charged metal, basically. And so if you put two magnets together and put the opposite polarity facing each other, you could tangibly feel them pull together. Nature wants to make a circuit with positive and negative, and you'd actually feel that pull together if you have magnets in your hands. If you flip one of the magnets over, you'll feel them push away, because the same polarity always will break a circuit. So nature wants positive and negative to come together to make a circuit. When you flip that around, it pushes away. So our bodies are actually very similar to a magnet in the sense that certain anatomical parts of our bodies are positively charged and other parts are negatively charged. For example, the hand, the palm side of the hand is positively charged. The back side of the hand is negatively charged. And a part of the body that we use in muscle response testing all the time, we call it the polarity point. It's right between the eyes. This point right here is called the polarity point because it's the most positively charged place in the body. So if we want to check a circuit that we make to see if it's good or bad, this is how we check it. So I'm going to explain that to you right now by having a patient come over here, and we're actually going to explain and demonstrate how it's done. So Denise, come on over here. And so what we do is I typically use an arm. You could really use any muscle of the body, but I use what's called turn this way just for a sec, the middle deltoid. It's the middle part of your shoulder muscle here. So turn just a little bit at an angle here. So what I'm going to do is I just have the patient kind of lock out the elbow, and I give some resistance on the arm down here about by the wrist, just with a flat hand. And I'm just going to push down for about 1.5 seconds. Don't let me push down, just resist me pushing. Hold it up. Good. And so I could push pretty hard. Now, I'm bigger than her. I got leverage. I could probably make her arm go down, but I don't push with all my might. For about 1 second, I ramp up a push to hold that up strong, and I feel it lock out nice and strong. So I know I could use this muscle as what's called an indicator muscle. Now, what I'm going to do is actually literally close our circuit, because I'm touching her here, and I'm going to touch her on the polarity point we talked about. So I'm just going to touch here. Now we closed our circuit. I'm touching positive to positive. Don't let me push the arm down. Hold nice and strong. And it just goes down with no resistance at all. I feel a little bit, but no lockout at all. So hold strong. Yeah. Whereas if I do is just flip to the negative side of my hand. So now I'm touching negative to positive. Hold just as strong again. Now that doesn't change it. The strong muscle's still strong because we're making a normal circuit, positive and negative. But all I have to do is flip that around to the positive side and hold real strong. See, we're making a bad circuit. We're purposely shorting out our circuit that we're making. Thanks. So I'm going to explain this a little bit more, and then we'll show you a little bit more how it works. So really, when I'm checking, I'm a doctor of chiropractic. So one of the first things I check, and if you've watched my previous video, I talk about what are called the 4 pillars of health. The first one is structure. So I want to check everywhere where the nervous system comes out of the body from the spinal cord. So for example, if I wanted to check the neck, let's say a patient has a sore neck or is getting headaches, and I want to check the cervical spine or the neck, I would make that circuit. In fact, let's show that again. Why don't you come over and let's just show how that looks like if I were to check the structure of her neck. If she's having neck pain, the first thing I would do is, after I check to the polarity to make sure she's on and working, so hold real strong, and she is, then I would just reach around and touch the entire 7 vertebrae of the cervical spine. So hold up the arm real strong here. Yeah, but let's say if that went weak, so just for the sake of the demonstration, so let's say we go weak, and I'm suspecting, okay, she's got something going on with one of her vertebrae, then I'd start at one side at the top. I'd try C1, cervical 1, and just for the sake of demonstration, let's say it goes weak. Then I would make the proper adjustment. And chiropractic adjustments can be done dozens of ways. It's not just the traditional, popping or cracking where you get it to move. You could actually even do it energetically, very gently and easy, but just as effective on the body. So let's say we correct that problem in C1 on the left. Then I would go back just to check my work. We're going to make a circuit now, a circuit right over C1, and we're going to recheck it, and it's strong. Then we know we got it. We took the pressure off the nerve. Thank you. So if we think of your nervous system like wires. Your nerves are like wires because they are a lot like wires. In fact, they have an insulation on them, the myelin sheath, very similar to wires, and they conduct electrical energy. So if you're, in a sense, shorting out an area over any area of the spine or extremities, it could be the wrist, the elbows, the pelvis, and you're shorting out your wires, your nerves, you could not only get pain. Pain is only 1 out of 9 functions of a nerve. All of our organs, every cell and tissue of our body needs that nerve innervation. So if you're pinching a nerve, whether it's in your neck or anywhere where the nerves come out of the spinal cord, you could potentially be doing a lot of harm to the body. Pain is only one of the things. Pain is sort of the alarm system saying, do something about this. But you could get any problem from a structural impingement. When you're shorting out that electrical flow, it's like stepping on a hose that you need a certain amount of water to get to where it's going. And if you step on the hose, maybe you're getting some water, but you're not getting enough. If you're watering plants, maybe they could die or start to get diseased or have problems because they're not getting the water they need. And it's the same thing with our nervous system. We need a certain flow of that energy to every cell of our body. And if that's being impinged and you're shorting out a nerve that we could test by making a circuit, you got to fix that and take that pressure system or that pressure off the nervous system. So that would just be checking a structural problem using muscle response testing. Now, there's other things that you could use muscle response testing points. These are called meridian access points. These meridian access points were discovered hundreds of years ago by Eastern or traditional Chinese medicine, where it is going over electrically charged points on the body. These meridian access points are for every organ system of the body. You have one for the heart, the liver, the gallbladder, the stomach, the spleen, the pancreas, all of the organ systems of the body. And so these electrical points on the body could be tested, just like you could test the neck, the mid-back, the low back, anything else, electrically by making a circuit to find out exactly where the problem is. And then there's a way to actually find out where is that electrical impingement coming from. So as I would, again, just like I showed you before, make a circuit with somebody, use a indicator muscle, usually using the arm. If they can't use the arm, I could use really any muscle of the body. Just convenient a lot of times to have them hold their arm up and use the middle deltoid. But if I touch, let's say, over the heart meridian access point, and a strong muscle goes weak, that's telling me something's wrong with the heart. I'm not diagnosing some type of heart condition because all I know is electrically it's showing weak. So I want to find out why it's weak. So I'm going to have Denise come back again. I want to show you how I would actually find the underlying cause of that electrical weakness of the heart. So let's just say again, just for example wise, if I touched, which is right in the middle of the sternum here, the meridian access point for the heart, and I'm making a circuit, I'm touching here, we now have a closed circuit, and let's just say for sake of demonstration that it goes weak when I touch here, so I'm not feeling the lockout. I would then add something into my circuit. So now I want to check the other pillars of health. I want to check for structure, biochemistry, emotion. So I would then have her touch with her other hand her whole forehead. And the reason why I would do that is because you have 2 points here and here on the forehead that are for emotion. These are electrical meridian access points for emotion. So now we're adding that into our circuit. And let's say suddenly that gets it from weak to strong. We made a change. That's the body's way of saying emotion's part of why her heart is showing weak. Then I would check another thing. We actually have reflex points on the inside of these joints of the fingers and right just kind of near the tear ducts of the eyes. So I would match up those 2 points by saying, take this hand and touch just near the tear ducts with the first 2 fingers, and I'd check that point again. We're going to check now for toxins to see if toxins is what's making the heart meridian access point weak. And so we would test, and let's say that's strong. Well, now I know that it could be toxins, because if it wasn't, it would stay weak, because we already checked the heart in the clear was weak. We're looking for something that would change that. If this changed that means it's going to be emotion. If this changes it, we're checking to see if toxins will change this. We're really trying to find the underlying cause of why it's showing weak. So then the last thing is I would use the last 2 fingers, these digits, and put them in those same spots. This is checking for a biochemistry or nutrition deficiency. So we'd go in here, and let's say, for example, this goes weak. So we made no change. It started off weak and it stays weak, so that's not making a difference. Thank you. So what we're really doing by using muscle tests, checking these critical points on the body, it's in a sense almost like an electrician trying to diagnose or to find what's wrong with the electrical system here. Where is the short? In other words, why are we shorting out the power here? This is a quick, effective, and very tried and true way of finding out the underlying cause. So then if that patient, let's say, for example, was the heart, and I found that the underlying cause was a nutrition deficiency and a emotional or stress problem, then I would know exactly how to treat that problem. I would treat it with organic food concentrates, right? A supplement of an organic food concentrate specifically for the heart. And then I would use a system of muscle testing that helps me find out what emotions specifically are doing this to the body. And I use a system of muscle testing that quickly finds what emotion it is. But I use muscle response testing for that. So muscle response testing is a great way to find things that sometimes even our traditional tests, blood tests, imaging, other tests that are great, I use them all the time, but it could even go beyond that to quickly and easily and unevasively find out what is the underlying cause of a problem. So there's a system of muscle testing called applied kinesiology, or AK. Great system using muscle testing to, again, pinpoint, is this coming from something else? Every muscle in your body shares nerves with an organ in your body. In physiology, they call this a viscerosomatic response. In Latin, viscero means organ, and somatic is muscle. So a viscerosomatic response means some organ is causing a muscle response. How does that happen? It happens because your nervous system, as the nerves exit your spine, they divide. So you have this nerve root that comes out of your spinal cord, and the nerve divides. Some of the innervation of that nerve root innervate a muscle. The other part of that same nerve root innervates an organ. So again, if you think of your nerves like wires, they're wired together. So one could affect the other because they share that same thing. So one's kind of shorting out the other if you have a problem. So for example, somebody could have a problem in their neck again, and we'll just use that as an example. And one of the big muscles that turn the neck, this muscle here, the SCM muscle, the sternocleidomastoid muscle, flexes and rotates the neck, powerful neck muscle. Those muscles share nerves with your sinuses. So if somebody's got allergies or sinus trouble, they could potentially be shutting off or affecting that SCM muscle, and that SCM muscle attaches way up here at the base of the skull, and you could have your neck go out all the time and have headaches or other problems. But instead of just adjusting it all the time and putting it back where it goes, it'll just keep going back out of alignment if you don't fix the muscle that moves that joint. And to do that, sometimes you have to look at the organs that share nerves with those muscles. And even when you look at those organs, you have to find out, why is that organ having a problem? That's why I check for emotion, biochemistry or nutrition, and toxins, as well as structure, to really get to the underlying cause of that problem. So applied kinesiology is a system that checks those correlations, right? If you test a specific muscle, you isolate a muscle, and it's weak, you would actually have them touch over a meridian axis point for the organ that shares nerves with that muscle. And if it changes it, you know that you got to treat the organ, not just that muscle or that joint that's going out of alignment that the muscle's attached to. So really, it's like a domino effect. You got to go back to that first domino that caused this series of events that ends in the symptom. Otherwise, we're just chasing symptoms all the time. You could fix a symptom with drugs or even chiropractic adjustments or natural things, but you're just chasing the symptom all the time. You have to get to that underlying cause. So I want to explain now, hopefully this is a very brief, and I'm trying to make this as understandable as possible. Explaining muscle response testing is a little more complicated, a lot more science behind it, but I'm trying to make it where it's easily understandable. There is sort of another phase of how you can muscle test. I use a technique called neuromodulation technique, NMT. That technique is actually designed, as well as other techniques, to not just check the making a circuit by touching a patient and making these circuits. It can actually be done energetically. So how is that done? The best way I've ever explained or heard the explanation of energy and how we're all connected by energy is to kind of go to the vast and then go to the most smallest thing we could think of. So we start with the universe, right? That's the biggest thing we could think of that we're aware of. You got the universe, you got our solar system, you got our planet Earth, then you got us on planet Earth, our bodies. And if you go smaller to our bodies, well, we got organ systems all in our bodies. If you go smaller than that, if you just keep powering lower and lower on the microscope, inside the organs you got cells. And if you go smaller than the cell, we got molecules. And then smaller than molecules, you have atoms. And if you go smaller than an atom, what you have is energy. And energy is the same for everything. We're all made of that same energy. Our bodies, the ocean, the stars, everything is made of that same energy. So in a sense, that energy, that moving energy that never started, will never end, and is just in different forms and could move in and out of form, we're all connected in that energy grid. And because of that, we could energetically test. For example, Denise, I'm going to have you come back, and I'm actually going to show how, instead of just making a circuit, right? I already explained the circuit. I touch her here, I touch her here. This makes a bad circuit when I touch positive to positive. This makes a good circuit when we touch positive to negative, so that indicator muscle stays strong. Well, what if we don't close the circuit and we ask something to the body, right? Now we're talking about just a thought, not completing a circuit. I want to check a powerful thing called congruency, right? What is she congruent with? So Denise has lovely brown eyes. She's probably congruent with the idea that she has brown eyes, right? So I want you to just say, I have brown eyes.
I have brown eyes.
Hold that arm up strong. That doesn't change. That strong muscle stayed strong because she's congruent with the idea that she's got brown eyes. Now I want you to purposely lie, something you're not congruent, you're incongruent with, and say, I have blue eyes. Just say that.
I have blue eyes.
And hold real strong. That strong muscle just drops. I barely touch. She has no power. And the reason why, thank you, is because she's incongruent. So congruency, just like the original polygraph test, a lie detector test, your electricity in your body changes when you're incongruent versus when you're congruent. So using muscle response testing, we could actually find out certain emotions that you're congruent with or incongruent with. I just used a real rudimentary and basic thing about asking eye color, just finding, are you congruent with this idea or are you incongruent with it? But we use this idea of congruency and using muscle response testing to find out emotional stress issues that could have a huge effect on the body. I use that a lot when checking for emotions, when checking to actually take the charge, the electrical charge off certain emotions that are affecting the body and causing the body's energy to go down. I use that idea of congruency. It's not necessarily yes or no answers. It's what are you congruent with? What is your emotional reality congruent with? And I use a series of questions and key words using muscle response testing to actually find out what emotions are doing this to your body. If it was the heart, if it was the adrenal glands, if it was some part of the body that's having a problem, I tested it's weak, and emotion is showing as one of those issues. I use a system of muscle testing that actually finds, quickly and safely finds, what is the underlying cause and get the charge off that emotion. So congruency is part of how this all plays out. Another thing is intention. The power of intention is huge. For example, in neuromodulation technique, let's say it could be clearing allergies or clearing any problem that I'm finding with the body, is I would use a system that actually asks very specific questions to the body. And sometimes my patients aren't familiar with that jargon. They didn't necessarily take physiology classes, so they don't know what the amygdala is or the basal ganglia of the brain, because their jargon is something else, whatever they're trained in, that I don't know about. But I know that jargon because that's what I'm trained in. So if I want to ask the body a specific question, the body actually is responding to my intention. I could say it in Mandarin Chinese, I could say it in Spanish, French, or English, and the patient muscle response testing with their arm would be exactly the same, no matter what language I use, so long as I know what I'm asking. If my intention is clear in what I'm asking, the muscle response test will be the same. Because the power of intention, the body understands on a subconscious level what my intention in the question is, and then finding that answer via muscle response testing. So what I do in my practice now is actually using energetic muscle testing instead of, and I'm again tapping into the energy of somebody that we're all connected with. So I'm going to have Denise come back again, and instead of showing just how I would do it if she was in my office, when she's in my office, I would check all the systems of her body, all the meridian access points, all the structural areas of her entire spine, and a lot of it I'd tailor based off of her history and exam findings. But let's say, for example, I wanted to check her heart meridian right here. Instead of touching, making the circuit, and checking, if I wanted to do this energetically, I would just use my own muscle response testing. Let's say I was just on the phone with Denise, and I would ask her body certain questions. Instead of doing the muscle response testing, I would use my own muscles. There's lots of ways to do it. I'm real comfortable with what's called the O-ring method. I just make 2 O-rings with my finger and thumbs, and I interconnect them where they're like a chain, and I pull apart. And if you're squeezing hard, it's real hard to pull those muscles apart. But all I would do is energetically either ask her body the question about her eye congruency. Let's say, for example, Denise, do you have brown eyes? Well, it stays the same. You have blue eyes. I can't hold it. It pulls right apart because my intention is very clear with what I'm asking her. But I could do the same thing for asking about any meridian system of the body. I would energetically check over the heart meridian. I could check the lung meridians. I could check the liver meridian. And if there was a problem, just like what would make her arm go down, I can't hold my muscles together. It just pulls apart. The circuit is bad. And we do that on an energetic level. Again, we're all connected via this energy that makes up everything. So that's how I would energetically do the same things. And in fact, when I check a patient remotely, I would examine them the exact same way I would if they were in my office. I'd start by checking their polarity just to make sure they're on, right? Just to make sure I can muscle test them. And sometimes that doesn't work. It's really rare, but then there's things you could do to fix it to get their polarity back on again. But most of the time people are polar. If you touch positive to positive, that strong muscle is going to go weak. I would do that energetically. And then examining structurally all the areas of the spine or extremities if that was the problem. And then check all the meridian access points for every organ system of the body, making notes of that, just like I would in my office. And then anything that showed weak, I would cross-check to all the pillars of health. So if the heart was weak, I would check it to emotion. I would check it to the first two fingers of the body. Remember, checking toxins. The last two fingers inside, checking for nutrition deficiency. And whatever I found, I would make notes of that. And now we know the underlying cause. Thank you. So once you got to that underlying cause, I'd treat it the same. I would treat it the same with either a nutritional supplement, using homeopathy for clearing the toxins, use the technique I use that uses muscle response testing to find what emotion needs to be cleared. Or if it was a structure problem, I would energetically work over that area of the body to clear the structure issue. So this again was a very brief explanation of muscle testing. It is much more complicated than that, but I hope that I at least explained it in a way that would help you understand a little bit more how it works, why it works. So I hope you like this. Thank you for watching this video. Please like and subscribe, and we'll be back with you again very soon with another video explaining different things that could be treated in this way.